The time is now for the American people to speak up. At a time when the American healthcare system is deeply broken, we are the only major country on earth not to guarantee healthcare to all people. We pay the highest costs. Trump's big, beautiful bill will make that situation in healthcare even worse. As a result of that legislation, 15 million Americans will be thrown off of Medicaid and the Affordable Care Act. Studies from Yale University and the University of Pennsylvania suggest that when you throw 15 million low-income and working-class people off of the health care they have, some 50,000 Americans will die unnecessarily every single year.
They can't even afford rent, let alone covering health care for themselves or their children. But do you see what they're doing? They're cutting health care for 13.7 million Americans, the largest cut to health care in U.S. history, to give tax cuts to billionaires and to big corporations. Yep. This is your priority. Live with it. Defend it. Speak about why it is you are doing this. Yeah. Because that is the consequence of your actions. Donald Trump told you to do it? Or is this what your constituent asked for?
I can tell you right now, I represent New Jersey. Up and down my state, people are afraid, people are hurting. People who run hospitals, who run clinics are saying there is a tsunami coming to this state and to this nation. We have to stand up and fight right now. This is a time where we all should be coming together to do something to alleviate the rising costs, the loss of health care, and the pain that Americans are about to get hit with.
The government shutdown was just a couple of days ago, but yesterday, October 2nd, I got this letter talking about how my monthly premiums are going to go up for my health insurance. They obviously sent this out before the shutdown even took place in order for me to get it yesterday. So look at this. 2025 monthly payment is $218. They broke it down for me though. Thank you. Here's the math, bitch. Monthly premium of $627 minus $409 of financial help you get each month. That's the Affordable Care Act going away. So $627 is right now. Starting in January, it's going to be $727. So not only did they take away the $409, they increased this motherfucker by $100 a month. What the fuck?
They are absolutely correct, you guys. And right here is a little side-by-side comparison because, you know, MAGA, they love to look at charts and they need something, some sort of picture so that they can really understand things. So this is with the Affordable Cares Act. This is without the Affordable Cares Act. And this is what the Democratic Party was trying to stop before this whole government shutdown because the Republican Party wants to remove the Affordable Cares Act. That's what they want to do. It's not about undocumented migrants getting health care. It is not about that. It is about the lower class and middle class citizens here in the United States of America that can afford health insurance, plain and simple. And here's the other thing, you guys. The job market, the economy, since Donald Trump has taken office, it is the worst economy since peak COVID time. The worst economy. The job market, non-existent. Every single month when they end up releasing the jobs report, guess what? They're not adding new jobs. They're taking away jobs here in America. That is what they are doing. And for those that aren't from America, you guys have to understand this also. A simple hospital visit for someone, if they don't have health insurance, let's say they go to the hospital, they have to go to the emergency room and they're sick and they need urgent care right then and there. A simple visit can literally cost the American person thousands, if not tens of thousands, just going to the hospital. And I know you're thinking, well, just don't pay the bill. Well, here in America, guess what? If you have a job, they will garnish your wages. So now you're making even less money on your paycheck because you ended up having an emergency visit to the hospital. Also, here in America, if you don't have health insurance, and let's say you get taken by an ambulance and everything, let's say you need an ambulance and you call, you're like, yo, I need someone, you know, that right there could be tens of thousands of dollars as well. Let me know your thoughts in your comments over this way, because that is what the Democratic Party is trying to stop with this whole government shutdown.
So Republicans shut down the government because they want to take health care away from millions of people. Even if you believe the lies that this is all about undocumented immigrants. How can you think you're a good person wanting to take away health care from millions of people? How do you call yourself a Christian? Do you really think this is what Jesus would do? Taking away health care from fellow Christians? And if you remember the last time the Republicans tried to shut down the government, what was it over? Food stamps. They wanted to take away food disproportionately from hungry kids. How can you think you're on the side of good? How do you call yourself a patriot and yet want to take away health care from millions of people? And if your immediate reaction is to go, oh yeah, well the Democrats bad, that's you being defensive because you know deep down.
Hello, what's up everybody? What's up brothers and sisters? Welcome back to the channel, and I hope you're doing great from wherever you're watching this video from, and welcome back for another video. Now, let's talk about this blatant open betrayal of Americans or of MAGA supporters by their very, very own government. It's becoming painfully obvious that the MAGA politicians have never or are actually not fighting for MAGA supporters, and they are not fighting for Americans at all. They have never even, never even thought about it. In fact, if anything, they are fighting against Americans. The same movement, the same MAGA movement that once claimed to stand for the forgotten men and women of America is now openly showing them the middle finger right now. So this week, we've been hearing of strong suggestions among the Republicans to cancel healthcare subsidies, the same subsidies that millions of working class Americans rely on to basically survive. And if this happens, the people who will feel the hardest or will be hit the hardest are not the elites. They're not even the immigrants that they are trying or they keep blaming, but it is the everyday MAGA supporter, the everyday ordinary American themselves. And why are we calling this a betrayal? America spends close to $1 trillion on their military budget. It's not a country that they are at war. They don't have a civil war within their borders, but they spend close to $1 trillion in their military. But that same country cannot afford to give their own citizens basic, affordable healthcare. And it's a first world nation. It's the richest country on earth. Many Americans have reacted to this news in many different ways. Let's sample a few of reactions from Americans, and we'll be back with a deeper analysis. See you on the other side.
The shutdown fight has exposed how broken our healthcare system is. Can you believe that premiums are going to go up 100% for 24 million American families if we don't extend the tax credits for the Affordable Care Act? That means tens of thousands of people will go without care, and thousands of people will simply die without care. The reality is we need Medicare for all in this country. Every person from the day they are born should have health care. This is the time to reintroduce the idea of Medicare for all and start to demand that we vote on it in the Capitol.
Thanks very much for joining me. Let's be clear. Our healthcare system today is incredibly broken, dysfunctional, and cruel. 85 million Americans are uninsured or underinsured. We pay the highest prices in the world by far for healthcare. 1 out of 4 Americans can't afford the outrageous prices of prescription drugs. We don't have enough doctors, nurses, dentists, mental health counselors, or other healthcare professionals. Our life expectancy is already far lower than other major countries. Yes, our healthcare system today is already broken. And in my view, in order to remedy that crisis, we have got to do what every other major country on earth does. Not a radical idea, and that is to guarantee health care to all people as a human right. But what I have to tell you is that in the midst of all of this, the dysfunctionality of the current healthcare system, Donald Trump and his friends are making a horrific situation even worse. In fact, they are pushing our healthcare system over the edge to the verge of collapse. Now, you think your health insurance costs are high right now? You think you're already paying the highest prices in the world for healthcare? Well, guess what? Within the next couple of weeks, millions of Americans are going to get a letter from their insurance companies telling them that their insurance premiums will double. Let me repeat. As a result of Trump's big, beautiful bill and massive cuts to the Affordable Care Act, your health insurance premiums for 24 million Americans are going to double. And maybe even worse, could get worse. As part of that big, beautiful bill, 15 million Americans will be thrown off of Medicaid and the Affordable Care Act. Studies from Yale University and the University of Pennsylvania suggest that when you throw 15 million low-income and working-class people off of the health care they have, some 50,000 people will die unnecessarily every single year. It's not hard to figure out why. If you're low-income, you're working class, you're sick, you don't have any health insurance, you can't go to a doctor, you can't get into a hospital, you know what? You're going to die. 50,000 people unnecessarily every single year. But it's not just insurance premiums or getting thrown off the health care that you have. As part of these awful cuts, nursing homes in America are going to be decimated. My office has studied some of this. The nursing home situation in America today is a disaster. They're understaffed. And the way we treat the elderly and disabled who are in nursing homes is something we should be ashamed about. But guess what? When 2 out of 3 people in nursing homes are dependent on Medicaid, that situation is going to become much worse. Rural hospitals are going to be hard hit. Republicans like to talk about investing $50 billion into rural health care, but what they somehow forgot to tell you is that their cuts in the bill are $150 billion. In other words, they put $50 billion in after taking $150 billion out. That's a loss of $100 billion for rural health care. Further, we're talking about community health centers. 32 million Americans, all walks of life, get their health care, primary health care, dental care, mental health counseling, low-cost prescription drugs from community health centers. They are going to be decimated as a result of these cuts. So my friends, this is, in my view, what this government shutdown is all about. Republicans want what they call a clean CR. And what that means, for the first time ever, what they want to do is push forward a bill and get it passed without any Democratic input. Now, in the Senate, the rules are clear. They need 60 votes. And what that means always is there has to be bipartisanship. You want 60 votes, you got to have both parties coming together. Republicans are not doing that. They're not negotiating. They're simply saying, take it or leave it my way or the highway. Well, many of us in Congress are not going to take it. So that is what this whole government shutdown is about. Now, you may not hear much of it from the media, or you may not hear it from most Democrats or Republicans, but that is the simple truth. So let me be as honest as I can be. And that is, I do not intend to vote for legislation that will allow 50,000 Americans to die unnecessarily every single year. Ain't going to get my vote. So let me conclude by asking for your help. I can give all the speeches I want. Other members of Congress can give great speeches. They do fine. But what's more important is that my colleagues hear from you. So right now I am asking people all over this country, including you, you, to share your story. I am the ranking member of the Senate Health, Education, Labor, and Pensions Committee, and I want to hear from you as to what a doubling of your health care premiums will mean for you and your family. I want to hear what it will mean if you are one of the 15 million people being thrown off the health care you have because of the massive cuts to Medicaid and the Affordable Care Act. I want to hear from you as to what it will mean if you have a family member in a nursing home and that nursing home has got to cut back on staffing because they don't have the funds or maybe even shut down. What does it mean if you're currently visiting a rural health center, you live near a rural hospital?
People deserve free or at least affordable health care, and that shouldn't be a divisive take, but in the United States it is. And Democrats are fighting for millions of Americans to retain at least some semblance of affordable health care, even as Republicans wish to strip it away from Americans. And that's at the crux what this government shutdown is about. Democrats wish to keep people with benefits that otherwise would make certain that they do not have access to affordable health care. And when we say they won't have access to affordable health care, who among us can take an almost $27,000 a year hit? Because that's exactly what's going to happen to the average American utilizing Affordable Care Act subsidies. In the top 5 states, according to a new analysis done, the average cost paid is $2,750 a year with subsidies. Without the subsidies, that average cost is expected to rise to $30,000 for the average family. So you're going to go from just under $216-ish a month to almost or right at $2,500 a month. Who among us can afford that kind of change just to make certain that we and our families are healthy? Because that's what Democrats are fighting for, is to keep money in American citizens' pockets and out of the pockets of billionaire corporations and CEOs. They want to make certain that the middle class and low income are protected, while Republicans want to put more money in billionaires' pockets.
My friend who's retired, I believe she's 67 now, just got her Medicare Advantage premium details for next year. And her out-of-pocket maximum expense went from $4,200 a year to over $10,000. So if she has some kind of emergency where she requires hospitalization or emergency room care on a retiree's income, she gets to pay up to $10,200. This is Republican policy. She lives in the state of Indiana. And this is what all the cuts to everything are doing, all the budget cuts to every state. And these are the decisions each state is making individually on what's going to be cut, who's going to have to pay more. And people think that there's going to be an end to this shutdown. You've got Caroline Leavitt lying, Donald Trump lying about all these people not getting paid, all of these layoffs. They don't give a rat's ass about layoffs. If they did, they would have cared about the 280,000 federal workers who lost their job because the guy who runs X and his little 19-year-olds wanted to give so much more money to the billionaire class in tax cuts that they just stuck it to all of us. They didn't care about those 280,000 employees, former employees. And now we're coming up to nearly 1 million Americans laid off because of the tariffs, because of all the funding cuts, because of all the deportations. Almost 1 million employees. They don't care about them. They don't care about them. And to think that Republicans actually believe this administration cares about the government workers being furloughed right now over this shutdown thing. Macro view. Project 2025 wants the Affordable Care Act completely dismantled. They're gutting it. This is on their way to doing that. Once it's gutted, there'll be no more government subsidies for any of us, meaning our tax dollars being pooled collectively and then dispersed to bring down our healthcare costs. No, instead, they're going to privatize everything. So their cronies are going to make a shit ton of money, starting companies that can fill the need or just giving contracts to the companies that already exist, all those MAGA donors. And nothing will be for us. Everything will be out of pocket. We are fucked. So this shutdown is not going to end because Republicans care about people being laid off or because they care about how much we're going to be paying for health care. So there you go. In the meanwhile, look for all your premium hikes next year. And now foreclosures, it was just announced, foreclosures are at an all-time high because people can't afford to live in their homes. It's all coming together swimmingly.
Do Democrats want to give illegal immigrants health care at your expense? Is that what the government shutdown fight is all about? Is it really based on a word game that could actually cost Americans hundreds in health care? Here's the trick that President Donald Trump and Vice President J.D. Vance are playing on you. It's a word game trick. Yes, some migrants get health care benefits, but they're not illegal immigrants. They're called lawfully present. They include refugees, asylum seekers, DACA recipients, people with work visas. They have legal status. They pay taxes. They're following the rules. Back in March, Republicans stripped health care from 1.4 million of these legal immigrants in Trump's tax bill. Now the Republicans are calling that same group illegals to make the Democrats look bad for wanting to restore the cuts. And the actual undocumented immigrants, the illegal immigrants, they can only get emergency room care, which is a fraction of 1% of healthcare spending. They can't get Medicaid, they can't get Medicare, or ACA subsidies. That's been the federal law. Since 1996, nothing has changed. Here's what matters to your wallet. Without these ACA subsidies, 24 million American citizens will see premiums jump 75%. That's hundreds of dollars more per month for health insurance for American citizens. So don't fall for a word game. The fight here is about keeping healthcare affordable for Americans.
I pulled a Republican aside on the floor and I said, hey man, there's no cameras around here. I just want to understand. Like, I'm not here to put you on blast in front of a camera, just person to person. I genuinely want to understand, because people think that trying to understand another person means that you agree with them or that you're being soft on them. And it's a huge problem in this day and age, because that mentality really prevents people from being able to connect and persuade. But I pulled this guy aside and I said, hey man, like, I know that you represent a couple of rural hospitals, and this bill is going to devastate rural hospitals. I just want to know from your perspective, are you worried about that? What are you thinking about with your hospitals and your people? Because a lot of people don't know, like a ton of ACA recipients are in red states. A lot of Medicaid recipients are in red states. These are like Trump voters that are almost disproportionately, in many circumstances, being negatively affected. And so I said, like, walk me through how you see this. And he was like, yeah, I just don't believe it. He's like, I know that you guys need to make a big deal out of this to like score political points, but I just don't believe it. And I'm kind of sitting here like, this data shows that this bill is going to devastate a lot of people. But a lot of these folks just like don't believe that data. You know, there was one hospital in one of these districts. I was like, yeah, we might have to close. And they are now on their back foot. Like, they thought this was just a Democratic talking point. And now that their own people are being affected and their own hospitals are warning them, they are now kind of low-key panicking.
Let me repeat that. I know it sounds amazing, but it is true, and it's understandable. If you're throwing 15 million low-income and working-class people, many of them with serious health problems, off their health care, they can't get to a doctor when they need to. It is not shocking to understand, or surprising to understand, that 50,000 of them will die unnecessarily every single year. That's what we're looking at. And then, on top of all that, the Republican bill also cuts tax credits for the Affordable Care Act. A study just came out yesterday from the Kaiser Family Foundation, a nonprofit healthcare organization. and its findings are pretty clear. Within the next several months, healthcare premiums for 20 million Americans on the Affordable Care Act will double. Got that? Double. So you think that right now you're paying an outrageous amount for health care, and you are. And right now you can't afford health care, and many of you can't. Under the Republican proposal, your premiums will, on average, double. This is insane. It is unacceptable. In other words, instead of lowering health care costs, instead of adding more people to health care, cutting back on the number of people who are uninsured or underinsured, what Trump's legislation does is make a terrible situation much worse. So don't get confused. I know there's a lot of stuff in the media, and a lot of people in both political parties are arguing with each other and blaming each other. But to me, what is going on is really not complicated. And that is, if we do what the Republicans want us to do and pass a clean CR with no input at all from the opposition, if we just do that, 15 million Americans will lose their health insurance and tens of thousands will die unnecessarily every single year. If we pass the Republican legislation, your premiums will likely double in the very, very near future. Needless to say, I do not intend to support the Republican proposal.
Our government is giving that government billions of dollars to blow them up while telling us they don't have any money to raise the minimum wage. So you think that fighting for health care in America has nothing to do with how free health care is given to a country that gets billions of dollars from Americans? Let's really talk about this. Let's really think about this. So in America, there is an entire big budget. The budget is allocated to different issues that America finds important. We give metaphorical pennies and cents to Americans, especially Black Americans, when it comes to healthcare and when it comes to education. Our government can give billions of dollars to an international entity while telling us during the campaign they don't have money for us. But I'm the one crazy and focused on the way hit. It don't even make sense. Don't even make sense at all. They don't have money for insulin. They didn't have money to make sure they ain't have money for all this shit, but they got money for this, and you mad at me. So during the campaign, was we or was we not talking about education and healthcare? During the campaign, did we not explicitly talk about how Project 2025 would impact healthcare and public education? Did we? Why are you getting mad that during the election, I talked about how there were also funds taken away from our public education and healthcare that was going to a public foreign entity, and you got mad at me? How that make sense? We can't focus on Palestine. We got to focus on us. They giving money to blow up Palestinians over you having food to eat. They giving more money to them over there so me and you can fight about student loan debt. We ain't got, what they got done, y'all being unfair. Stop bullshitting me. None of this, what it is too. A lot of y'all that's the loudest about this, you don't do no work, you don't know shit.
The reason the government is shut down is all over Obamacare subsidies that expire at the end of the year. Yeah, I mean, the Democrat ask was initially for some other things as well, but we can focus on this. Explain the subsidies. Yeah, so one of the tenets of Obamacare is premium tax credits that were initially confined only to those whose income was between 100% and 400% of the federal poverty level. So in 2014, when the ACA passed, anyone making between roughly $11,000 and $50,000 a year who bought healthcare on the ACA marketplace were given tax credits that ensured their premiums stayed between 2 to 9.8% of their income, depending on how much they made. Yeah, and then during COVID, Biden signed the American Rescue Plan in 2021 that expanded these tax credits to anyone on ACA healthcare, regardless if you're making more than the 400% of the federal poverty level. So this capped everyone's premiums at 8.5% and also increased subsidies even more than before for those making less than the 400% federal poverty level. Yeah, but those changes were set to expire in 2022, but then Biden signed the Inflation Reduction Act, which extended these new subsidies even further until the end of 2025, and that's what we're approaching. Well, Democrats had all three chambers of government when they added these subsidies, and even they decided to make them temporary, as these were always supposed to be temporary COVID relief programs. But now too many Americans' livelihoods are dependent on these subsidies. Studies suggest if they go away, over 4 million Americans will become uninsured because ACA premiums will more than double, which is why even MAGA people like Marjorie Taylor Greene has said she will back extending these subsidies, as she has realized millions of Americans, along with her own adult children, will have their premiums double without them. Well, a couple things here. First off, if these subsidies go away, all that happens is back to the initial ACA subsidy rules, the way it was from 2014 to 2021, the way Obama intended it. And second off, these subsidies end at the end of the year. Republicans have said they're willing to negotiate them, but shutting down the government 2 months before their elimination and using federal workers and services as pawns is not the way to proceed. Well, it's because the subsidies need to be extended now, as insurance companies are forward-looking, and many are already raising premiums in anticipation of subsidies being removed, as it would kick people out of the market and they will lose business. And that's the other thing. Both Republicans and Democrats want cheaper healthcare. There's just a difference of philosophy in how we get there. We think the way is less government involvement and free market forces. There's a reason why insurance companies and universities love all these government subsidies, because it allows them to raise prices exponentially and in ways they wouldn't be able to do in a free market system, as the government, which is the taxpayer, is the one paying the increase. Well, then what's your plan to ensure on January 1st, 2026, millions of Americans don't lose their insurance because of doubling premiums? I mean, Democrats have acknowledged Obamacare isn't perfect and we are willing to negotiate changes, but I mean, shit, I think we want to go the opposite direction, closer to a Medicare for all system. But right now, the focus should be ensuring millions of Americans aren't screwed at the end of the year. Yeah, and we are willing to have that negotiation too with an open government. And I think we can admit Obamacare has failed. Premiums and deductibles have risen and you actually can't keep your doctor. So I think the American people want a different solution other than just continuing to feed this beast, which, if these subsidies are continued, will cost the taxpayer, according to the CBO, over $335 billion over the next 10 years, which, I'm sorry, is money we don't have and therefore is paid through inflation. Well, I'm sorry, I think if we're going to deficit spending on healthcare for Americans is the most noble way to do so. When Obamacare has cut the uninsured rate in our country nearly in half, and millions of Americans will feel pain if part of it is eliminated at year end, so tread carefully. Open the government and we can talk.
Democrats in the Senate voted to keep the government closed for the remainder of the weekend, and the question is, are there actually illegal aliens receiving Medicaid? That whole thing is the impetus of our shutdown. And whether you like this or not, it's an undisputed fact that under the Biden administration, there were undocumented immigrants receiving taxpayer-funded health care. Here are the facts. Last year, Medicaid costs for emergency services for illegal aliens skyrocketed 142%, totaling $9.1 billion. From 2020 to 2024, Medicaid spending for emergency services for illegals tripled under Joe Biden, up 196%. In 2023, under the Biden administration, South California's, and I quote, entire healthcare system was being bombarded by illegal aliens, enforcing American citizens to endure longer wait times. In Denver, Colorado, the CEO of Denver Health stated that 8,000 illegal immigrants made 20,000 visits to the city's health center in 2023. That all left an uncompensated bill totaling over $10 million. The Congressional Budget Office estimates that there are about 1.2 million illegal immigrants receiving Medicaid. Those are just a few examples. So that's why in the one big beautiful bill that was passed a few months ago, the Trump administration and Republicans made sure that those who are not American citizens were not receiving free taxpayer-funded health. Democrats want to add all that money back and give people who did not deserve free health care. If somebody says to you there are no illegal aliens receiving Medicaid, you show them this.
We all have to get behind the Democrats calling for a shutdown. And Trump supporters, I am talking to you too. We need the Affordable Care Act subsidies to become permanent. And over 50 conservative groups are urging Trump to let them expire. And let me tell you, this is one example of the math. A couple who are 55 years old, collectively bringing in $85,000 a year, currently pay, on average, in healthcare premiums, $7,500 a year. If these Affordable Care Act subsidies expire, their premium, are you listening to me, Trump supporters? Their premium jumps to $24,000 a year. So while the billionaire class continues to become ungodly wealthy under this administration, private healthcare insurers and all of their executives are going to make a shit ton of money because they'll get to charge you another $17,000 a year. Just a couple making $85,000 a year. A lot of us don't make that much. Who can afford to have 25% of their income go to healthcare premiums. We're just going to become uninsured. No one's going to be able to afford that. Are you ready for this, Trump supporters? Instead of owning the libs, can we not all get together and agree this is really, really, really bad and it's okay to jump sides one issue at a time?
Okay, welcome back. And you have heard what Americans are saying, and we wonder if ever MAGA supporters have or are even learning a lesson from what is happening with their favorite government. So let's go. Let's get into this. So healthcare in America, one thing the world knows is that healthcare in America is synonymous with expensive, unaffordably expensive. Every American is always crying how healthcare in America is absurdly expensive. It is political and it is politically weaponized. So let's be real. Healthcare in America is already absurdly unaffordable. And even with insurance, most Americans we've been hearing they have been talking out are already drowning in medical debt. A simple visit to the hospital will simply just ruin your finances. That is what America is like today. Prescription prices are a joke in America. And this is something that anybody can access, from Americans crying every single day of how they cannot even afford basic medicines or over-the-counter drugs. And millions avoid hospitals simply because, they can't afford the bill. And yet, instead of fixing this broken system, MAGA Republicans are actually trying to remove the few existing safety nets that are not even enough, like healthcare subsidies under the ACA, the Affordable, Care Act. They are framing it as cutting government wastage. But what they are really doing is cutting people's lifelines, literally, because many families, these subsidies, are the only thing standing between them and being declared bankrupt. So when MAGA politicians talk about freedom, maybe what they mean is freedom to suffer alone, And the Democrats' dilemma, or the standoff here, so Democrats are actually trying to prevent a government shutdown, partly because they want to protect these healthcare subsidies. But the Republicans have turned the standoff into a kind of circus. They are framing Democrats as socialist. We've been hearing them saying that, who care more about giving benefits to immigrants or outsiders, or awarding American privileges to outsiders than Americans. And this is exactly where the irony kicks in. Immigrants in the first place are not even entitled to federal healthcare benefits, and they can't access most of these subsidies. And more so, the so-called the undocumented immigrants get almost nothing of this. So Republicans' narrative isn't just really dishonest. It is deliberately misleading. It is misinformation when they say that Democrats are fighting for immigrants to have these American, privileges. They're using immigrants as scapegoats again and again to distract Americans from realizing that the real threat to their their own lives, their livelihoods, isn't coming from outside the borders, as MAGA is trying to tell you. It's actually coming from the same people that they voted for. So this MAGA populism, in essence, was never about the people, and it's now becoming clearer on every passing day. At its core, this is the perfect example of how MAGA populism has transformed into a kind of a political scam. It started as a movement claiming to stand with the working class Americans, putting America first, making America great. the factory worker, the ordinary American farmer, everyday citizen. But over time, it has become a shield for the ultra rich, and a political tool for elites to manipulate the masses through anger, and fear and misinformation, of course. And they tell their followers that immigrants are stealing their jobs, that the Democrats are destroying America, and that freedom means a smaller government, even when that really means no healthcare, no support, no protection for them at all. It's emotional manipulation disguised as patriotism, as protection. And the saddest part, many MAGA supporters still believe in their interest, in these people that are lying to them day in, day out, night and day. And who really benefits from these cuts? Why do they want to withdraw the subsidies? See, there's always someone pulling the strings to their benefit behind the curtains. So if we were to ask the real questions, who really benefits from cutting healthcare subsidies, from plunging the ordinary Americans into this healthcare crisis? It's not you as an American. It's not the average everyday American. The beneficiaries are the big corporates in the pharmaceutical, the insurance giants, and the pharmaceutical lobbyists who bankroll these same politicians. When healthcare subsidies go away, millions drop their coverage, and the private companies, they do what they know how to do best. They raise their premiums even higher. It's a win for the corporate profit. It's not public well-being, not at all. So meanwhile, MAGA politicians continue taking donations from these corporates, these billionaires who will never really actually need any insurance subsidies in their lives. And the people they claim to fight for, they're left struggling, sick and confused, wondering, why life keeps getting even harder, even though they voted for America first, or they voted for making America great again. So this is a country that is obviously trying to abandon its own people. Every great nation is actually measured by how it really treats the most vulnerable in that community, in that country. How can politicians talk about, right now America is really failing that test. If you want to gauge a good society, you look at how it really treats the most vulnerable in that society, the poorest and the weakest in all senses of that word. And how can a country that spends over 800 billion USD on military not even afford to give its own citizens that pay all that taxes affordable healthcare? How can politicians really talk about protecting America while millions of Americans can't even afford basic medicine? And the truth is, this isn't about affordability. You know what it is about? It's about priorities, and America's priorities, or the MAGA priorities, are totally upside down. Well, by design, of course. So MAGA movement sold itself as, the savior of the working class Americans. But what it has really become, it's a betrayal of its own base, starting from the MAGA voters. It has betrayed the farmers. It has betrayed all of the people that really are the common everyday MAGA supporters. Of course, you'd say it has betrayed all Americans, even those that didn't vote for them. But it's better that there are few people who really expected this. There are many people that have been coming out to say, yeah, we knew this was coming. We tried to warn you against this regime, but you didn't listen. I guess the people that voted for this, some of them were ignorant and some of them didn't know. And now they are realizing the hard way that they voted against their own interests. The Republican leaders are not standing up for the people who really trusted them. They are exploiting them. They are exploiting their anger, their patriotism, and even exploiting them in their pain. And when those same people lose their healthcare, they will be told to blame the immigrants, not realizing that they've been really stabbed by, in the back by their very own politicians, those that come waving, those flags in their faces. So maybe the real question need to be asked: what has happened to America? Or maybe when will Americans, especially the MAGA supporters, wake up and realize who is really destroying them from the inside, of course? Yes, so that is the debate. Do let me know what you think about it. Share your opinions, your thoughts in the comment section below. If you like this video, give it a thumbs up. If you're new to the channel, then please hit the subscribe button to be part of us. And I'll see you in the next video.